call the meeting order. That's Mr. Cal, lead us in invocation, please.
Heavenly Father, as we come to you today, we come to you just asking for your guidance and your wisdom, Lord, as we deliberate and make decisions that affect our children, our staff, our citizens of Levy County. We ask that we just always put you first and foremost, and that your wisdom be imparted upon us. Lord, we lift up those that are sick, those that have been hurt, those that have lost loved ones here recently. So we know that we have several close family members of our school family that are dealing with sickness and illness, and we also just lift up those people to the north of us that have had injury to accidents and things like that, the citizens in the young boy in Dixie County. And we just ask all these things, Lord, as we come to you today, and we ask that you just always keep our students and our staff safe. In your name we pray. Amen.
Amen.
Raise the flag. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Clark. Are there any additional corrections to the agenda?
Move adoption of the agenda.
Second.
Been moved and seconded. Any further discussion? All in favor say aye.
Aye.
All opposed, nay. Motion passes. We'd like to welcome all of our visitors today. Now will be a time for public comment if anyone had something they'd like to address the board about. If not, we'll move right in. Ms. Kaylee Wade, here, annual update.
Good morning, board members. I am pleased to introduce Rick Hensley and Michelle and Raquel from Here, and they, I sent you the packet of the presentation. We're having technical difficulties this morning, so we are just going to go through the packet that's in front of you. And so they are going to give you an update, and then we'll be time for questions that you may have. Okay. Good morning, board.
Good morning.
Thank you for the invitation this morning. I appreciate that. I'm Michelle Angley. I'm the Chief Clinical Officer and Senior Vice President of Operations. I have with me Rick Hensley, our Director of Clinical Services, our Senior Director, and Raquel Nunez, our Clinical Director as well. So thank you for this opportunity to spend a few minutes to talk about the wonderful things that have happened this past year and ongoing at the Health Center. It's hard to believe that we have been in partnership with you all for 5 years. It was 5 years in January, so thank you for that opportunity. You should have with you in your packet about 5 pages. We're going to hit a couple of highlights, then I'm going to open it up for questions. The first page is the executive summary. It really shows the key takeaways for the year. This report period actually looks at October 2017 through the end of September of 2018. So the executive summary, which shows the key takeaways, really shows some wonderful things that have happened this past year, report period in the Health Center. We'll do a high-level overview on the financial report. We'll look at the Health Center, the types of diagnoses, the things that we're seeing in the Health Center, and then we'll talk a little bit about the health risk assessment and the wellness initiatives. So when we look at the financial report, the health savings associated with the Health Center was $361,921. In the next page, we'll do a deeper dive into how we came to that calculation. Your employees, the associates of the county, had a copay savings of $276.25. So great savings on behalf of the employees. The market visit cost, we did a comparison of the average office visit cost in the market in relationship to the same type of appointments seen in the Health Center. Yielded an office visit cost in the market of $159, and in the Health Center, $79.42. We'll do a quick overview of the total client cost. We looked at it month over month. There were 2 months in the year that had 3 pay periods, so you'll see a spike in that. The overall budget for the next 12 months went up 2.9% to $599,914. Then we'll jump over to the Health Center. Utilization is running at about 77% utilization. There's about 67% of the employees that have actually utilized the Health Center programs. We had about 4,100 appointments for the year in this report period, and a total number of unique patients that have accessed the health center of 665. Your no-show rate for using the health center was 3.2%. That's a fantastic no-show rate. The average nationally in the market is about 17%. So that was great to see. We'll do a quick overview of the types of diagnoses that we saw, medications and labs when we get to that next section. And then we'll do a deep dive into the health risk assessments. That is the blood draw and the questionnaire. It really gives an overview of your overall health, a report card, if you will. So we had 248 health risk assessments. 208 of those were employees, 34 dependents, and we had 6 retirees that utilized the health risk assessment. A total of 32% of the employees actually had a health risk assessment. As part of the health risk assessment, we do what we call a cost avoidance. We look at the monitoring index of early conditions that are first diagnosed or recognized when someone has a health risk assessment. We'll talk about that. There were 166 wellness contacts, unique patients that we had access to, and a goal setting of about 47. Questions with respect to the executive summary?
On the health center, what do you attribute the increase, the 15.4% increase?
And the health center costs, we did have an increase in our physician to mid-level ratio. So there was an increase of about 32% in our overall physician fee. So that did increase the office visit cost. The previous year, you were sitting at about $69 per office visit cost. Great question.
And then are we going to talk about some things that we can do to increase participation in the HRA?
Yes, I would love to be able to do that, yes. If time warrants, absolutely. Okay, we'll move on to page 2, where we'll do a deep dive into financials. Their overall average employee count was 654. We saw an average of 6.4 visits per employee. That includes dependents and retirees. When you see a health center becomes more mature, the visit count per employee does go down a little bit. On average, 4 to 4.5 visits per employee. The total client cost this report period was $582,890. Below that, you'll see the bar graph there that shows the total client cost by month. I did reference there are 2 months in this report period where there was an increase because there were 3 pay periods. That was the month of November and May. When we look at distribution of costs of that $582,890, we'll quickly go over this donut graph here of showing where the cost distribution was. So staff was about 48% of that fee at $279,000, followed by labs and supplies in pink of 10% of $60,000. Medications in the kind of teal color at $62,000, and then the program fees at $180,000. Questions there?
What are the program fees? What is that?
Said differently, that's the management fee. All right, the next section there, we'll talk about the health center visit cost of $79.42 versus the market cost of $159. So we received some data from you all that showed the cost of office visits in the market, which yielded about $224,586. Now, it's important to note that we compare apples to apples as far as office visit costs. So when we look at your total overall spend, there are things that we take out, obviously. Specialist visits, ER visits, those kinds of things. But when we look at traditional family practice office visits, we're able to do a comparison. So of your spend, $224,586 of that was routine family practice, chronic and preventive medicine. Of that cost, there were about 1,408 visits, which yielded a market visit cost of $159.51. Now, how did we obtained the health center visit cost. We looked at the medical personnel costs plus the labs and supplies and divided that by the number of office visits we had in the health center, which yielded a cost of $79.42. Questions there? All right. Now, let's talk a little bit about the marketplace comparison. On the executive summary, I referenced that there was a cost savings for your plan of $361,921. How did we come to that conclusion? We took the number of visits in the health center, and there were 4,187 visits in the health center. If you were to move those visits to the market, times that by the average cost for market visit cost of $159, yielded a cost of $667,868. Those same office visits, 4,187, times that by $79.42, gave you a cost of $332,528, a difference of $335,340. I also included the medication costs, the cost avoidance associated with that. If you look over to the right where it says savings summary, you'll see the office visit and the lab savings of $335,340, plus the medication savings of $26,581, which yields a total savings of $361,921. Questions there? So let's jump down to patient savings. What is the impact to the patient? Obviously, it's significant. Patient savings was about $276.25 savings. What they would have paid as far as copay in the market. This is per employee. Okay, so again, $276.25 per employee. What's the impact? Obviously, convenience, financial benefits, efficiency, timeliness, and it's equitable. How do we calculate the patient savings? We took the total number of appointments, which was 4,187. I actually calculated based on the number of appointments that were actually kept, because we had a no-show of about 2.3%. So I used the actual number of appointments, which was 4,055, times that by $25, which is the copay, yielded a cost of $101,375. So again, there were 4,187 appointments, 4,055 of those were kept. So if you take that, times that by the copay of $25, again, the savings to the employees was $101,375. Let's talk about the prescription out-of-pocket savings. There's the $5 tier 1 out-of-pocket expense, times that by the number of medications we dispensed in the health center, and that was 3,759, times that by $5, yielded a cost of about $18,795.
What was the prescription number?
3,759. So you add those two together, you get a total savings of $120,170. Divide that by the number of unique employees that access the health center, was 435. So that gave a total patient savings cost of $276.25. Questions? So a great benefit, obviously, to your employees, significant. Convenience and the financial impact, timeliness and efficiencies.
Those no-shows, are they charged?
They are not. Now, in the market, they often are. If you have ever, unfortunately, had to cancel something last minute, particularly dentistry, there's oftentimes a $55 or $65 charge if you don't cancel within 24 or 48 hours. I will tell you about 35% of our partners do charge a no-show fee when it is above a certain percentage. Right now, we're fairly low, and utilization is such that is not impacting those others' ability to get in timely. We're running at about 77% utilization, which allows folks to be able to get in same day appointment. Oftentimes for teachers, it's important to get in the same day. Any other questions? All right, let's talk about the savings summary. I did reference the cost of the office visit, labs and savings. I also referenced the medication savings. But I think it's important to highlight the productivity savings while it's soft dollars, admittedly soft dollars. I'd like to reference it because it's pretty significant impact. The average time that someone takes away or takes off PTO or what have you to go to the market for an office visit is about 4 hours. Somebody takes a half day off to go to the doctor. In the health center, it's an hour or less. So we deducted 1 hour. We said the average 3 hours, an average hourly rate of $15 an hour nationally. That's 45 hours times the number of appointments we had in the health center. It's pretty significant. The savings of, again, soft dollars, but important to reference the loss of productivity, $188,415. So again, being able to compare the efficiency of the health center, you're in an hour or less, versus in the market, which is generally about a 4 hour difference. Questions there?
No, I don't have a question on it, but I do want to say this. That may be my favorite thing about that joint, and what, Carrie news is I do not like it. I just see sick is going to be done.
Sure.
And what really drives me nuts, we kind of hit on before. Say I have a 10 o'clock appointment. Well, I have that appointment, but that doctor blows that appointment off. I usually, you don't get to see him until noon. Even though you sat there and you paid your time, you get up, walk out, they're going to charge you. And anyway, to me, that productivity thing is huge.
It is.
Because it's, and in our care center, you go in there, your appointment's at 10 o'clock, you're looking at a doctor by 10:05. And he's not going, hey, I got another guy, I got to go. He's sitting there, okay, what else is bothering you? It's really in depth. And I think, to me, that's an intangible that cannot be priced, and that's a huge benefit. That's just comment, not a question.
Thank you for the comments. Yes, oftentimes the average office visit in the market is about 6 to 8 minutes that somebody spends with their physician. So if you think about it, I need to go in there and the physician I'm seeing is going to introduce themselves, ask me what's going on, assess me, listen to my chest, heart sounds, look in my ears, then make a diagnosis, then write a prescription. That's about a minute of action item I just referenced. That is not quality of care. In the health center, you have the ability to have at least a minimum of 20 minutes, sometimes 40, sometimes an hour, depending on if you need physical and aid with physical, women's health and men's physical. The importance of having that uninterrupted time where you can build a relationship, establish yourselves, and really focus on continuity of care. So thank you for those comments. I really appreciate that. Any other questions? So again, productivity, while soft dollars, is so important and so impactful. Budget projections for next year, we're looking at about a 2.9% increase. We generally look at that based on a 3% increase in medical personnel, 4% increase in supplies, and about a 10% increase in medications. Utilization goes up, so do supply and demand, so do supplies, and so does medications. So an average of about 4.9% increase in the budget for next year. All right, we'll move on to the next section. This is called the clinical overview. We made 4,169 diagnoses in the 4,187 appointments we had. We dispensed 3,759 medications, and we ordered 2,352 different types of labs. When you look at the next section, we talk about diagnosis, and this is so incredibly important. Now, while we are only referencing the top 10, because there are 4,169, you will notice that in the diagnosis section, everything that is green is chronic, everything that is blue is acute. So if you look at this said differently, 8 out of the 10 that are referenced there are chronic diseases. And as you all know, 85% of your spend are chronics. So we are definitely impacting, touching, and influencing the chronics that we're managing. So again, 8 out of 10 is probably one of the highest I've ever seen. So congratulations to you all, definitely making a difference and an impact in the chronic population. The next section there is just a graph that just shows the same information of acute versus chronic. Questions there?
I have a quick question.
Yes.
So is this, so is this run like a clinic here, or is this a relation, like, do you establish a relationship with this doctor and see the same?
It is.
Is there a physician there? or-
Yes, there is. We have physician and mid-level
Okay.
for advanced practice nurse practitioner, physician's assistant. Yes, we are a primary care family practice health center.
So you have the choice to see a physician versus if you would rather?
Absolutely. Absolutely. do. Great question.
I would suggest actually you haven't been there. So we're visiting them.
I really encourage you, for those of you who haven't, to get a health risk assessment. That's the blood work, about a 14 question questionnaire. It talks about your lifestyle, your smoke, so on and so forth. You take that questionnaire, you take the blood work that you have done, it's a 28-panel blood draw. It gives you an overall health score. It's like a report card, a snapshot of where you are right now. What's wonderful about the health risk assessment is that 85% of all diseases are diagnosed by blood work. So if you think about it, you can't see, smell, or touch elevated cholesterol, right? And oftentimes you don't know you have an elevated blood sugar. But if you get the HRA, you can see where you are and where you may be trending. If we don't impact you, educate you, and encourage you to make some behavioral changes, dietary changes, exercise, lifestyle changes to impact positively, that HRA lab work.
Yeah, that's bad. They, thanks to my parents, high cholesterol, genetics, and we've gone through diet and exercise on it. Basically, we're just born with bad blood, and we get a little pill.
Yep.
That my wife gets on because I don't take it like I should when I go see the doctor. He goes, you know, you gotta take that. Yeah, I know. But that leads to, you kind of get a relationship. At first, I was concerned that, okay, well, when I don't know the guy, it'll be like a quick care center. But no, I have good relationships. When I go, they chastise me about the fact that I'm addicted to fried foods and don't really care to jog or any of that. Taking that little pill every night kind of is on the nerves. Between them and my wife, they have this crazy idea they want to keep me alive. But I'm very happy with it. I think anybody that uses it is happy.
Great, I'm so glad to hear that. Oftentimes, if you think about it, secondary to your spouse or significant other, your healthcare provider is your most trusted advocate. You think about it. You will often share information, you will listen to that primary care provider more so than you will listen to others, sometimes spouses. And so that continuity of care, that relationship that you establish is extremely meaningful and can move you into a better habits, lifestyle changes, and better outcomes. So thank you for sharing that. Let's look at medications quickly. You'll see, again, we are...
Do you mind if I
I have a quick question.
Yes, absolutely.
on the diagnosis versus chronic versus acute, is there an ideal ratio, national standard that you compare that to?
Mm-hmm. In a primary care practice, you will typically see 60% of what you manage is chronic, 40% is acute. So we're sitting right around that. As a health center matures, you will see that the acutes will drop and the chronics will pick up as they establish a relationship. Oftentimes you'll see somebody will check us out for the first time, I got a sore throat, I've got an ear infection. And then, oh, by the way, you can see me for my diabetes, for my high cholesterol, so on and so forth, and they start establishing a relationship. And then that switches from acute now to managing more chronics.
And similarly, on the trend line,
Mm-hmm.
is that a reflection that we have positively affected health? Or are we just dropping off utilization? Because it looks like the lowest months are June, July, and August, when teachers are out doing other things, are really busy getting ready for the start of the school year.
Exactly. It's both. Great question. Oftentimes you'll see a reduction or a decrease in utilization in the summer months, particularly in our municipality partnerships. And oftentimes it has to do with, people are out vacationing, school is out, and to be perfectly honest, people are healthier in the summer than they are in the winter. Why is that? Because we're often in buildings, we're in close proximity to one another, and we just tend to get sicker in the winter and fall months than we do in the summer months. It's a great question. So yes to both of your questions, yes on utilization because of the summer, and yes, you are having impact positively on your chronics. People are getting healthier. The next page that I'm going to go over is probably fundamentally the most impactful report and one of the highest in the state of Florida. We have about 35 health centers in the state of Florida, and yours is significant in a positive way. So we can jump over to that if you like. Any other questions relative to medications? Just to highlight 5 out of those 10 that we referenced are chronic. Now, yes?
One question, as far as referrals to specialists, is that at the physician's discretion or is there a system?
Yes, now, so if you need to be referred, our providers will refer you out with the network, just like anywhere else, nothing different. They'll manage that, they'll quarterback that referral for you, refer you out, and then we'll receive that information back and ensure that you've had the appropriate care and individual. Good question. Any other questions relative to medication? Just as a side note, the average brand medication costs the plan about $95. I just want to highlight probably the fastest growing cost in the pharmacy spend is specialty drugs, as I'm sure you all probably know that. Your per day of therapy is 21 cents per patient. Let me say that again. Your average cost of therapy per patient is 21 cents. If you look at your PBM data compared to like CVS, Walgreens, that kind of thing, the average spend is between 80 to 90 cents per day per patient. So significantly impactful. Any other questions there? All right, let's move quickly on to the next page, the HRA summary report. I would definitely like to see, to your question, sir, how can we positively impact the great things that are happening in the health center, because your numbers are pretty significant. In the folks that are doing the health risk assessment, there is an impact, and that's on the next slide. But if we can creatively come up with different types of incentives to engage folks to do a health risk assessment, just want them to get in and get blood work. Let's see where they are. People are surprised at having a health risk assessment, and all of a sudden, I'm a runner, I eat pretty healthy, I stay away from fried foods, and you're telling me my cholesterol is 350? Why is that? Thank you, Mom and Dad. There are some things you can't impact, genetics being one, but you can impact the brevity of that 350 cholesterol by continuing to change behavior and taking medications, because again, genetics is something you can't impact. So, looking at this report here, there were 248 folks that did a health risk assessment, which is about 32% of your employee population. We found for the first time of those 248, there were 148 abnormalities that they didn't know they had. Whether that be elevated cholesterol, BMI, hypertension, high blood pressure, blood sugar. So when you look at this chart, you'll see red obviously is referencing people who have high or abnormal lab values. Blue, they're kind of borderline, right on the cusp. If we don't engage these folks, they could move to the red. And if we engage these folks, our hope is they'll move to the green. What is the green? Normal, healthy lab values. You've kind of got a microcosm of healthy individuals. A lot of stability here in this group. When you look down at the next section of health risk assessments, you will see that the prior year we had 273, and again this year's 248. So we've had a little bit of a decline. So what can we do to impact or further engage those folks that haven't had a health risk assessment? We talked about the health risk conditions. I said there were 148 that were diagnosed for the first time as having elevated blood sugar. For example, Angela, may I pick on you a moment? So Angela got her health risk assessment, and this is the first time she's had it done. Comes back, and we ask that you be fasting. That's important, particularly for blood sugar and cholesterol and triglycerides. Comes back, and her blood sugar is 115. So it's above the normal. 70 to 100 is about normal. So anytime we see anything above 105, our first question is, will you be fasting? And she says, no, I had Cinnabon on the way here. Okay, so let's check it again. We check it again, it comes back and it's 86. Great, we're fine. We check it again, she's fasting, and again it's above 105. So this is our opportunity as healthcare providers saying, Angela, we've got a pattern here of your blood sugar being above 105. If we don't start making some changes, educating you about diet, enhancing exercises, making some true behavioral changes, in 6 months I may have to put you on some diabetic medications. So that's extremely impactful. She said, I'm fine, I eat pretty healthy, I don't eat a lot of sugar, but she may be eating things that turn to sugar, rice being one, breads, anything that's white turns to sugar basically. And so the opportunity to educate her about the impact. So this is the first time she's had the health risk assessment, and this is the first time we've told her, you've got an elevated blood sugar. She said, I feel fine. Again, 85% of all diseases are diagnosed by blood work. You don't necessarily know you have an elevated lab study. So in looking at this health risk assessment, as I referenced, there were 148 abnormalities that we found. To be able to put a monetary index on those diseases if they're not captured and coached and engaged to making some behavioral changes, it can be significantly impactful. For example, the average cost a diabetic cost plan is about $10,683. That's from the National Institute of Health. So these are numbers on average the benefits plan spends on someone who's diabetic. So there were 26 instances where we had folks that had greater than 105 blood sugar. Again, cholesterol, there were 32 folks. Hypertension, there were 40. PSA, there was 1. And obesity of a BMI of greater than 30, 49. So again, the monetary index and the value of early detection is really paramount. Questions there? All right, my favorite slide. Yes?
So is this open for the health risk all year, or is there a week that?
Anytime. We encourage you to get it anytime. Preferably in the morning, because we're asking you to fast. About 8 to 12 hours, you can have water, black coffee, no sugar, no cream. It's important that you're hydrated.
I'm just wondering if there were like a awareness or something, like a week to, create awareness of it, or, I don't know, just
We
get the
can.
number up. It seems like a low
yeah.
number that you like in there.
It is considerably lower than I'd like to see it. But if we, as your partners, work together, we shepherd this marketing or communication of really empowering folks to get a health risk assessment, maybe using somebody as an example and saying, wow, I thought it was fine, and all of a sudden I did this health risk assessment, and oh my goodness, my cholesterol is really high, and I didn't know that. The importance of getting it done. Yes, sir?
I've been emailing some team members out there about some ideas on how we can reduce these numbers.
Ms. Gately, have we gone out to the sites this week?
We actually, our plan for the fall is to go out to the sites again and then to do the follow-up at the sites too. Because sometimes it's hard, especially if you're a teacher, to take off time during the day and that impacts our sub situation and further things. So our plan is to hit it again after school starts in the fall and then to follow up with them also at the school site.
Is there a cost to the health risk assessment, or is it a copay, or?
No, sir, there's no additional cost for that.
Anybody that's on our plan has no cost when they go to that clinic over there, so.
Oh,
Within the,
No cost for office visits, no cost for medications.
within the 4 walls of the health center, there's no copay, there's no deductible. Now, if, for example, Angela needs to be referred out for an orthopedic, she comes in and says, I've got knee pain, I, as her provider, says, I think you may have a meniscal tear, you've got something wrong with your kneecap, I'm going to send her to an orthopedist. Her insurance applies, she pays a copay, there's nothing different. But within the 4 walls of the health center, all services are at no additional cost.
I think, just Ashley asking the questions and then being new to her, that maybe, and I've been here and know about it and certainly had that done, but, in the schools, new people, they don't know, and that just, brings it out that we really need to get it out, or certainly do something, or on a training day, or,
New hire packet,
But they don't, it's not really explained, in a new hire pack, they may read or brief or not really apply it, and I think there are other things that we can do to get it out.
We do, at the new employee orientation, we have those that come in, we go over that. Anybody that comes in and does their insurance, I go over it with them, explain how to sign up. But our best tool are the other employees
Right.
promoting it in their schools, the ones that have used the center, promoting the center. So, I know they get a lot of emails from me. They claim to be the one that sends out most emails, but I try to send out pertinent ones.
Right, that's true. I think we've let Ashley down because we haven't explained it to her. We didn't tell her about it as board members. So, we need to, yeah, we all need to do it better and, get it out.
Well, actually, I'm happy to make you an appointment. It's on the benefit plan. I'm happy to make you an appointment. We'd love to see you. You all are the quarterbacks for the program. So you utilizing it and having a great experience and the benefits of finding something and catching it early with that early detection is invaluable. They're going to listen to us. So thank you for that.
Good to have us.
Can you look at age factors and if you statistically break it down, who's coming to the clinic and what they're finding there by age?
Yes, we do. Great question. We actually do a complete overall population health management, and I can get it down to the granular level. I can look at schools, I look at age, I can look at gender. It's a great question. Yes, we can get down to the granular level of the types of things that we're seeing.
Most of the people who are over 40, they're coming in from you or
I will tell you exactly.
a lot of teachers are young.
Let me get to that section and I will tell you. Age 37 is about the average. I will tell you as far as appointment frequency, and I apologize, this is not in the packet, but I'm happy to see more information. The appointment frequency, as far as employees, there were 212 employees, 83 dependents, retirees, and 129 dependents that came in exactly one time to the health center. On the other end of that spectrum, there were 39 people that came in greater than 20 times. And you ask yourself, someone's coming in greater than 20 times. There are several reasons why some of them will come in. They may have some brittle chronic diseases that need to be managed more frequently. They may be getting allergy shots. If you've ever had allergy shots, how are you going to go to the year? So in theory, you could have somebody come 50 times in a year. Great question.
Mr. Terry, we realize what cost savings and what benefit this is to our employees. That's part of the reason why we've reached out to the county a couple times to see if they'd like to join us.
And here's you back, I guess.
So to recap quickly on the HRA, it's so important to get that done. If you look at this top section here of reference, it's really a gas gauge. It's a report card, it's a snapshot of your total population health. Of the 32% of the folks that had it done, here's where they're at. Now can you imagine what it would look like if we got more people engaged in a health risk assessment? So that's exciting. Just again, a balance sheet of gas gauge. The next page, the risk movement, is the most impactful. This is my favorite graph of information. You'll see here that at the top, I had referenced earlier, there were 248 people that had a health risk assessment in this report period. There were 162 that have had it year over year over year. So that means I can watch their trend year over year over year. With me? So cohorts, year over year over year. 84% of those 162 have gotten healthy. This is only measurements of blood work and their questionnaire. There's nothing subjective in this data. It is just the measurements of their cholesterol, their sugar, their blood pressure, their total cholesterol, their triglycerides. Again, 84% have gotten healthier. That is significant, folks. Congratulations to you all. Again, I referenced we have 35 Health centers in Florida, and this is significant as far as percentages, so congratulations to you all. Let's look at that risk movement. If you look at the second box there that says at-risk participants, you will see that folks have moved from a lesser risk position moving to a more favorable direction. So if you look over to the right-hand side on the x-axis, you'll see the number 9. What does that mean? That means there were, last year, 3 people. You see the gray box says 3 and the next blue box says 1 under 9. There were 3 people that had all 9 risk factors. So, said differently, they're exponentially at risk. So, the risk movement that references on the left-hand side, BMI, hemoglobin A1C, glucose, systolic, diastolic, those are the 9 things we measure. See that? And then on the risk participants on the next graph, there were 3 people last year that had all 9. This year, this report period, there's 1. So they're moving from right to left in a good direction. Let's look at it again. There were 5 people in the previous year that had 8 risk factors. This report period, there are 3. Said again, last year there were 28 people that had 5 risk factors. In this report period, there are 24. So they're moving in a great direction. Questions there. Again, this is the most impactful. This is raw data, just measuring blood work and the questionnaire. Questions there?
I know Citrus County is, where else to partner that would be close to us?
Ocala.
Fernando County Sheriff.
Okay, so here's, I'm kind of beating around the bush to ask this question. A teacher that's in Yankeetown that may live in Crystal River, would there be a possibility that if there was a clinic close to their house, that they could partner, or does it always need to be to our clinic? That it would be a possibility? Can you track that employee that way?
Yes, yes, and yes. We would love that. So we are engaging in interlocal agreements with all of the municipalities and private sector entities where we partner. Because you'll have folks that live in the obscure corner of the county where they're actually closer to another municipality. We would love that. So we're working on a pilot program now. I think we have, how many, 4 or 6 that are?
4 that have committed, a couple more we're waiting on to do a pilot to try it,
Love to.
work out the bugs, and then start the expansion process.
So they would have access to the schedule, and we can track them by their employer ID. So great question, would love to do that, and I believe we're sending some information to Kaylee to review for the opportunity to do partnerships in other areas. So great question. This risk participant really shows you the impact the health center is having on your employees. They're listening, they're changing behavior, they're understanding their overall health, becoming more healthcare savvy, and that's noticeable, significantly noticeable by the reduction in their numbers. Any questions relative to the risk participants?
And then my only thing is if there's a way to try and encourage of maybe those pre-planning days, which I'm sure that's in our process, of maybe scheduling certain, okay, we're going to be at Bronson Elementary on Tuesday, we're going to be at Chiefland Elementary on Wednesday, and that way we can capture more. I mean, you can't force them, I guess, per se, to do that, but it is a benefit both to them, and it also then, obviously, the data shows there that if they're paying attention and listening to the people there, that it's effective and their health is benefiting them. So, and it's a long run cost savings for them and us, and just being healthier.
And well, that's the whole reason we entered into this partnership, instead of being a medical care, being a health care, where we can have employees that we don't, that their health is taken, they have a better quality of life because their health is better maintained and managed, and that there's things that they learn about that they didn't know. And so that their long-term care and their quality of life ends up being better, and therefore better serving our students. And so that's the whole idea of why we got into this business in the first place.
If you have healthier employees, you have better outcomes, period.
Of course.
Productivity is impacted all the way around. And just one other point I wanted to mention, that the health center is completely voluntary. So they're not mandated or required to use the health center. Their insurance card still applies, they can go out in the market, but they have found utilizing the health center has a lot of benefits. Continuity, time, efficiencies, and obviously cost savings. So, thank you for this opportunity to share this exciting information with you. I'll be here if you have any additional questions. But thank you again for this opportunity and appreciate the partnership. Yes, sir.
Is the school board associated with Blue Cross Blue Shield?
Yes,
I was just wondering if, just hypothetically, if the county commission suddenly had an epiphany and they wanted to hook up with this health center, that's an additional 400 employees or 500 employees they have. Would you have to add staff to accommodate them?
We would, a little bit. We also have to expand hours to be able to accommodate that need. So right now,
Which that only helps our employees.
Right.
correct.
Because there's
increase
added
access and
hours
availability.
and accessibility.
The best way for me, the way my little pea brain organizes this information, is that the care center is your daily health care system, your routine where you go. If you have to go out for specialized care, that's where Blue Cross Blue Shield comes in.
I think the county commissions with Blue Cross Blue Shield as well.
So,
So they would be just.
well, it doesn't matter who your major provider is, I believe.
Correct,
You
right.
know, it's just, this is for your healthcare provider, not your major medical provider.
Yeah, I was just curious, because that would be a significant increase in employees if they decided to do it.
It sure would.
And they can still keep it Blue Cross Blue Shield?
Absolutely, nothing changes, it's completely voluntary. And as I mentioned earlier, oftentimes they'll use us for the first time for something acute, like a sore throat, I couldn't get in to see my primary care provider, Dr. Smith, down the road. They come in and they went, oh, wow, this is a primary care facility. This is only for me, it's not open to the general public. The only way to access the health centers, you have to be a participant on the Blue Cross plan.
Let me add one more thing too, that not just what she's brought up today, but all of our pre-hire drug screens go through the care center, all of our DOT physicals for our bus drivers, which saves the district a lot of money. And all of our worker comp first report entries go through the care center. So if it gets taken care of at the care center, it's just a Band-Aid. It doesn't get reported. So we're good. So those are kind of dollars you can't attach a number to, but it does save the district money.
We appreciate you being very proactive about that.
And I have just one more question. So does the physician have like hospital access where they can say, this patient really is too sick and they can get them to the hospital?
We use hospitals, which most providers in the market now use. Do they have privileges? Oftentimes they do, but they don't make rounds, they use the hospitals.
Oh, okay.
Great question.
We also, wanted to also let you know, we've had some preliminary discussions with the Levy County Sheriff, the possibility of joining your health center as well. They're on a separate health plan from the county through the Sheriff's Association, so we're running some preliminary numbers, and we think that would help as well.
We've had folks that come in down there for an HRA, and they call 911.
We have found significant things on the health risk assessment.
I like Dr. Purdy, so
He's phenomenal.
he is,
Phenomenal. With that, we were lucky to get him, I feel like.
so I enjoyed, Allison did a great job, so I think she was the nurse practitioner who was there, and then, so when Dr. Purdy came on, so it's pretty much like the country doctor.
Go see Mark Swell.
That's right, yeah. Well, thank
Both the
you.
ladies, all the ladies over there have done a great job, so, and I know, I was looking here, I appreciate, so I was fortunate enough so that they caught a few things for me, so to help out. Obviously, I had to take a couple pills to help regulate a few things, so,
But I'm glad we caught that.
yes, and I'm working hard to not have to take those, so.
Yeah. So important. We had one individual, a department head at a municipality that really said, I haven't been to Darlington in 10 years, I don't go unless I'm really sick. I'm otherwise fine. And the city mayor said, sir, you will be. an HRA because you need to set an example for your team members. Get an HRA. He had an HRA. He was 55, so he did PSA, prostate-specific antigen. Guess what? It was significantly elevated. We did that on Wednesday. He had a follow-up on Friday. We referred him to an oncologist, and within 2 weeks he had surgery. He will say we saved his life, and we say we had an HRA. We captured. Otherwise, he was asymptomatic. He had no symptoms. He thought he was fine. So there's just a prime example.
I understand that asymptomatic very well, so. And I will say that, just, I'm gonna kind of put this out there, Mr. Brad Penny, who retired from us, so he's gonna be having some heart surgery on Friday. Another one of the guys who's running marathons, was the track coach, and unfortunately, so they are hopefully caught everything, and gonna get him on the end, so after Friday, so,
Well, thank you again for your time, and thank you for the partnership.
Okay. Kim Lake, 2019-2020 trim dates.
Good morning.
it's really ahead of schedule. You're on schedule.
Well, I have to get this moving so that I can pass the baton to Angela. So I'm here this morning to ask for the fiscal year 1920 trim calendar to be approved. I have submitted the calendar to the Department of Revenue, and they have reviewed the timetable and confirmed it is compliant with the required trim schedule. So there are several important dates on this recommended timetable. July 22nd is a Monday, and the first of the meetings to keep us in compliance. This will be a 9 a.m. meeting where we submit the proposed budget, which is normally referred to as a budget workshop. And the first budget workshop is already scheduled for June 25th. Next, we'll have our first public hearing and present the tentative millage and budget for fiscal year 1920 on Tuesday, July 30th at 6 p.m. And lastly, we'll have another public meeting to present our final millage and budget. We will also be asking for approval of the fiscal year 18-19 annual financial report and cost report at that meeting. And this meeting is scheduled for Tuesday, September 10th at 6 p.m.
Move adoption of the trim calendar as presented.
Second.
Moved and seconded, we adopt the trim calendar as presented. Any discussion? All in favor, say aye. All opposed, nay. Motion passes. Thank you, Ms. Lake. Are there any additional corrections to the minutes of the March 12th board meeting? All right, we're looking at. Moved and seconded, we approve March 12th board meeting minutes. Discussion? All in favor, say aye. All opposed, nay. Motion passes. Consent agenda. For time, we start on the other end today. Ms. Kowinski, if you'd like to go first. Mr. Adams?
All my questions were good.
How many people will on C7, the youth mental first aid, how many people that put us, that we have training, we got a couple people in Wilson that are training on that.
Yes, sir, we're trying to, because that training, it has to be 1 per 30.
1 per 30.
Yes, sir. Yeah.
All right. Thank you, sir.
Anything else, Mr. Gillard?
No, sir.
Ms. Brooks?
Nothing, I love seeing all the requests and field trips and things that the kids are going to do at the end of the year. Everything else has been answered, thank you.
I think the only thing I had was, Z7 on the contract. Is that just a moving contract, or we have an old out, in-house engineer,
Yes,
says
it's
a specific project?
kind of like our engineering projects that come up to do. It's not like for something that we go out like for a school. So it's, for example, just things that we have to do around here.
That's advertised rates, basically. Yes, sir.
These items that were taken out of the other ones, high school, computers, and all of that stuff. Was that part of the consent?
So, it's an addition to.
It's on the regular agenda.
Are you gonna advertise that, or the ad out?
Well, I think today's action item, if I read it correctly, is surplus, is that correct?
Right.
And then once it's done for surplus, then,
We use that to dump deals.
which is all allowed to sell.
Yeah, so some of these things, it's, once we do that, then we can sell some of it. But some of the stuff is not worth selling. It'll be, like the computers, they'll be packaged up and so on. They'll be, surplus.
Why is it, you're just saying some of these, is that, the number that's on here, is that what they were worth when they were purchased, or?
Yes, sir.
Now what they're worth now?
Well, it's just like a computer at your house, you buy them today, it's 3 years from now.
No, it doesn't say the date they were purchased. I was looking at some, you're giving away computers that are worth $1,500.
No, I think it says, if we read it correctly, the old Willis High School property is disposed of in the best interest of the board.
Right.
But 10 years ago, Terry, those computers would have been $5,000. Because that's how much a computer cost 10 years ago. And now you can buy a computer for $600.
Is that actually supposed to be the current value?
No, sir, that's not the commercial, that's the purchase price.
Okay. And what's the name of that website you put them on?
WDeals.com.
That's not, I'm gonna buy one, but that's.
We'll make you a good deal on one of these days.
Yeah, I bet.
On this one.
I wouldn't buy one of these because we've gone and taken out the hard drives.
Oh.
Not really gonna do it anymore.
And I go to Best Buy.
Okay, and then the other item I had, oh, that was, it was under two finance. There's awards, I mean, those for security, is that a continuation of those part of these? This is Power Max.
Yeah, those are just switches and stuff that we do, we bring.
But that's a continuation, that's not new business.
That's what they
So, any other? The agency's been moved and seconded to consent agenda. Any further discussion? Seeing none, all in favor say aye. Aye. All opposed, nay. Motion passes. Superintendent.
Just a few quick comments. I would like to, on April 23rd, I know many of you are, have participated in strategic planning workshops. And so between now and then, I'd like to schedule a board workshop after our regular meeting on the 23rd.
That's a morning.
This morning. So that each one of you can hear what's going on for the other plans. Yes, sir, that's April 23rd.
Approximately what?
Well, whenever this board meeting is over. Following the regular board meeting on the 23rd. Correct, because you don't have school, that's why.
What's the workshop?
Just to go strategic planning this year, so it's progress on it.
Okay. It's 28 days a week.
All right, yeah.
Also, I'd like to commend Mr. Masters and his team in Bronson Elementary, Bronsonville High School. We had a little bumper vendor last week, and I'm trying to keep informed on all that. But the team reacted very well, took care of our kids and our staff, and just how everything went on. It was just very good learning opportunity for us, and just a good outcome of how our folks reacted with it. And thankfully, we're blessed and nobody was successful. Also, Friday, we have Master Board training with Ross Elementary Blue. And the question is about lunch, and I'm going to age to bring, have somebody bring us some lunch, or kind of what do y'all want to do? It's a question y'all said. Sure. So if you're well prepared to bring us something?
Yeah, whatever y'all want.
Whatever you look at.
Make patient.
Sandwich.
Mr. Asbell will start.
Well, thanks.
Now we'll know how much time is left.
Mine's brief, mine's very brief. I would, must, say thank you to the maintenance department. This made one phone call to reason with an issue, just like that. And that's not just one time, that's every time, and I'm not the only board member that happens with. I'm not the only employee in the school system in Lee County where that happens. Lots of things work that way. And I've got to say how proud I am of our employees. We had, at Bronson Middle High School, I had a parent call me and had an issue with student drop-off. You know, as you know, on that side, you got 2 lanes sort of come around, you drop off on the outside lane. On the inside lane, it's a cut-on-through lane, get on out. We had some parents who were dropping kids off on that cut-off lane, and this parent called me and said, I'm concerned about running over a kid this morning. They're just running willy-nilly. Talked to the folks at Bronson Middle High School and said, this is the call I got. The next day, our assistant principal's out there going, nah, and they've straightened that up, and it's actually moving faster and safer. And I bring that up just to point out that happens every day in our county. It's little things that, you know, everybody notices when something major happens, but the little things that make this thing run and keep it flowing so smooth are really amazing. And that leads to another amazing thing. At the last meeting, I brought up that a couple of kids were donating their proceeds from their animals at the Swanee River Fair. And I won't get into the Swanee River Fair and all that. What I will say is something amazing happened. We had, I'm assuming Miss Angela Hogan headed this up. We had a group of employees right here in this building that contributed to that. They don't know these kids. They don't, all they saw was a need and some people were suffering. And it's amazing the heart people have. And they contributed that. And also, each one wrote a little note on the card for those kids and telling them they appreciated what those kids were doing. It really was amazing. It really touched me, and I told this to Chris the other day. Somehow I've become the old grumpy man like Rick Turner was, and I'm trying to change my ways. And they're not going to Rick Turner, if you know him. So there you go. But things are going great, and we're winding down the school year, so I think it's a pretty awesome time. I do have I'm hoping you'll have answers to this, because you always got your finger on the pulse of these things. I know we've gotten all kind of emails from Chris Dillon about various legislative things that are coming. Want to follow up on the bill that we kind of pushed. Do we have any word on that? And also, like, there's some school safety things that are going through and all that. Didn't know if y'all had any word on
I'll
that.
have Chris answer. I mean, I know he knows.
And then I'll let it go. That's all I got, Mr. Rick.
Our bill is not going to be heard this year. It got out there that this was a Levy County issue, and so the superintendent's help and the Superintendent's Association and going to kind of work some angles through FSBA and our small district to kind of reach out and effect to share that this is not an issue that is solely a Levy County issue. But that kind of got out there that that's what it was, so that our accommodations for students with disabilities, that this was only a Levy County issue. We know that it's not a Levy County issue. We know it's an issue truly that affects probably more small districts, affects a larger district that may have much more staff that can dig into this issue and kind of navigate the waters.
I do not know at this moment if words can explain to you how truly disappointed in every level of that thing I am. There's some silly stuff that goes through our legislature. You take a few minutes and look at it, and then when you have a real issue, that's what happens. Kind of kick the can down the road, maybe we'll shut up. Well, maybe we will, maybe we won't, but I know one human that we will not shut up. Because to say that's a Levy County issue, that tells you just how blind to the real needs of the students of the state of Florida our legislature is. And that paints to me a perfect picture of a lot of uselessness in Tallahassee. And we all may have friends up there and all that. As far as I'm concerned, that tells you a lot about what we got in Tallahassee. That's no knock on, that's not shooting a messenger.
I know. And I'll say, I don't like it, but it's best basically, whenever I got that word, I think last Tuesday or when you and I talked, so maybe it was maybe Thursday, but anyways, the comment was made that the normal cycle of a bill like that is 3 years. So I'm trusting our lobbyist who made that comment to me, and I expressed to her my frustration with that, and I'm hoping, I shouldn't say I'm not hoping, so I know that this will spur me to work harder on behalf of those students that need those accommodations. I do believe that there's going to be a conversation with the Ed Commissioner that maybe we won't ever need this bill, that he can, through the swipe of his pen, make.
Who's gonna have that conversation?
So, well, actually, he's going to be at the FSBA Days and Legislatures next week, so he will be there. We have, I think, about an hour with him that he's coming to speak to the School Boards Association. So
I don't mean this in any disrespect, but the time for flowery speeches and patting on the back and, oh, you do a great job is over. Too many times I see people go up there and they, hey, I appreciate the job y'all are doing, hey, y'all are great people, thank you, thank you, thank you. When the reality is, they're dropping the ball. And to sit there and put sugarcoat, flat out, this is where the problem is, let's fix the problem. And you and I, we can both discuss the head of the education department. And, we're not supposed to insult him, we're not supposed to talk about him, but I'm not a fan. And I'm not impressed with the man. And that's not the school board of Levy County saying that. That's Cameron Asbell, the father of children that go to classic public schools.
there is no doubt that I believe our ability to have differing sides and have the ability to tell someone that, could you look at it this way, that is hampered at this point in time with the people that are in power. I do believe that there is the ability behind closed doors where you can disagree with people, but the people that are in charge right now in public, there can be retribution for disagreeing with them, and that's the best way that I could put things to them. So,
And as we have learned through our master board training, that is no way to accomplish one thing.
not to be a part of a team where everyone needs to have a seat at the table and have a voice, because every child deserves to have their voice heard and what their needs are to be able to met, especially at this time where there is talk of choice. And I feel like this goes right along hand in hand with that conversation. So, piggybacking off, Mr. Breeze.
I'm done.
So, piggybacking, Breezy, thank you. So we had the multi-court opening in Cedar Key, so took that tennis court, and we now have a tennis court / pickleball, which don't ask me, I don't know what pickleball is. So, but there's some people down there that like to play pickleball, and a basketball court, which eventually, and then it's going to be kind of a hopscotch. I think there's another, it's almost like cornhole that they put out there, so through kind of the public and the community donating quite a few dollars, they repainted the courts, and Breezy and them we're working hard, so we got cameras up on there to thwart any kind of vandalism and just all, water fountain, so it was out there, so appreciate all that, so, and also appreciate your help for the bathrooms out in Rosewood, so that was a big help. We had 8 high schools come and participate in a team, and we had bathrooms that went down, and Breezy was, for better fun, Johnny on the spot, so he got it taken care of, so. And we had portable bathrooms out there, so we had Porta Johns out there. So. But he does, so I know Breezy's a phone call, and I know he gets hit from every angle of the county, so appreciate all of your staff working hard to get that done, so that was very important. So also like to, Miss Lake left out, but Miss Lake and Miss Pam, so have been very beneficial, I think, to the finance department and just their efforts So very appreciate your hard work. So this weekend is the Arts Festival. Come on down. So there'll be grilled shrimp, be hamburgers at the PTO booth, clam fritters at the junior class, and kind of anything and everything else in between. So come down and we'll help separate you from some of your money and go to a good cause. So appreciate that because it's the second to the biggest fundraisers for our Cedar Key School. And then since Ms. Clemency is gone, so we made history together as a board, bought the first Yankeetown Animal and Swanee River Fair. We bought their chapter hall. So, and to see those 3 kids, well, actually it was 4 kids, I think, that walked up there together. So in the sail ring. So it was just a wonderful thing, and some good hard kids. And just it never ceases to amaze me. So Cameron and John do a fabulous job. So I know they had help with Mac Hubers, who's one of our employees, and some different people, and kind of wrangling and twisting arms and getting money and supporting the Bronson area kids. So Brad and Jimmy Cason go a long way, and actually did a lot in the Williston area. It's Brookins, Brandy Horn, and West Grant, Julie, that group. So it just amazes me how giving our communities are and how they come together to take care of our kids. And just, we know that learning doesn't all take place in a classroom. It's a valuable experience for those kids. So,
I agree with everything Kim said. My favorite was wonderful. It was a great experience. And all good. Those kids in Yankeetown were really sweet about all of them and thanking everybody. So that was really nice. Chris, on the legislative days, do you have our schedule?
working on that as we speak. So I texted Kim about that. So yes.
Okay, all right. And then at Chiefland High School, Chiefland Middle High School the other day, we had a visit by Neil Dunn at Kimberly Baker's classroom, her civics class. And it was just a great experience for the kids. Those 8th graders asked high-level questions. He was very impressed. And it was nice that he came and took the time to visit the kids in the classroom. And I think it made an impact on them. It was very meaningful. It was a great visit. And then also on our strategic planning workshop update, and we're supposed to be on these committees. I haven't been on this. I haven't done anything with my
We
city
have one that's
committee.
been scheduled. I just want to do this.
Okay, all right. I thought I was behind this. Okay.
He was out, we didn't see those. He was at a safety meeting.
So are we going to schedule some of that before we have our workshop on that? Okay. All right. Thank you very much.
I don't have a whole lot. I did enjoy Friday, our strategic planning, financial. So those, when you do a strategic planning, you can go everywhere. So I spent most of the time like trying to hold it in what we were. But I think that's the good part about it. And then once you dive into all that and then everybody does that and it comes back together, I think there'll be some, I know out of our meeting, I think there'll be some good things coming. I'm sure your groups will also, that they'll put our county forward. I won't keep going on about the fair, but it's amazing to me that a little tri-county area with no industry comes together and spends $1 million every year. Just gives it, and this year was even more because the way they changed it. I always said that our people weren't buying animals, they were investing in their kids. And then this year they didn't even bring the animals up, they just walked the kid up, put him on a block. And basically said, we're going to donate to you. Isn't that what happened? And that's what we've been doing for years. And if you look at the people and who did over there last Wednesday.
It was a little interesting. I tried to help those Yankeetown kids, and I started making some phone calls. And I had a lady, I won't say what business she is down there, but she offered to give me $100 to keep the steer off the slaughter.
But like a little kid from Williston came to me and said, Mr. Brown, I'm trying to raise some money to sell my pig and all. He had his little list for buyers, and he had gone around and he got 25 cents from this person, 50 for this person. I said, well, I grilled him. I did a Cameron House building. I grilled him about his whole project, break even, and all. This kid's like 11 years old. He had it all. And I said, well, how much you going to sell your pig for? He on $6 an hour. He said, I still got an hour left before buy and sell, and I think I'm gonna get it done. But it's more than just, I mean, that kid may be one of the best salesmen we know in the future, but he started with a project there at the fair. And people mentoring him through that process, so it still continues to work. Somebody said, why do you go do what you do up there? I was not raised on a ranch or a farm, but that was the first project that I had. I do what I do today because of that fair, so still appreciate what it does.
He talked about it, I said, go on my camera, asked, but I have others, and I cannot believe you asked this question to my child. I said, well, you need to know how much, it's business, you gotta know how much you got in here. And I said, it's better in managing this fund that John and I have written. I have to know you cut off, I need to know where you need to be. And I said, do you know how much your child is? No, I don't have any idea. I said, it's a good thing your child does. Kid did, well, I think, boom, 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 boom. He rattled it off, and tell me where he bought his stuff, and, that was pretty cool.
That's part of it.
That was neat, and that kid, he did okay. He did okay.
Yeah, yes, that's true.
Got a school visit time.
School visits, yes, sir. Bronson Elementary and Bronson Middle High School today. Lunch is on Mr. Asbell for anybody who'd like to go. Is there
How
any
many
other?
come depends on that we may be hot dogs at a certain day.
On that one.
Any other business